Hi everyone, and welcome back to my YouTube channel. My name is Priya Mistry and I'm the TMJ doc. Today's video is about sleep apnea, upper airway resistance syndrome, also called UARS, and how all of that relates to TMJ disorders. Many of my patients have sleep apnea and they have UARS, and it's something I really see on a daily basis. So if you want to learn more about this, watch this video until the end to learn about the connection between sleep apnea, UARS, and TMJ disorders. For those of you who don't know me, my name is Priya Mistry and I'm a general dentist with a practice in beautiful Portland, Oregon, where we are dedicated to taking care of patients with TMJ disorders. I work here with my wonderful mentor, Dr. Arthur L. Parker. If you haven't already, be sure to check out our office website as well as my Instagram handle. I post here quite frequently with a lot of tips and trivia regarding TMJ disorders. So if you like to nerd out on TMJ stuff like I do, please be sure to check out my Instagram. So let's get right into it. So what exactly is sleep apnea? What exactly is upper airway resistance syndrome, UARS? So sleep apnea is essentially when you stop breathing for 10 seconds or longer, multiple times throughout the night. That's kind of the quick and easy definition of it. This cessation of breathing leads to multiple arousals. Your body will literally wake you up if you're not breathing. Oftentimes, these arousals go undetected by the affected individual and they fall back asleep pretty quickly. You may have sleep apnea if you snore, if you wake up multiple times at night to use the restroom, if you wake up gasping for air, or if you feel exhausted, even after a full night of sleep. Upper airway resistance syndrome, or UARS, is when the soft tissues of the throat relax. This relaxation of these tissues then reduces the size of the airway. When I say airway, I'm talking about the airspace behind your nose and your mouth, the nasopharyngeal airway. Cessation of breathing, so completely stopping breathing, does not often occur with UARS, which is why it goes undetected on so many routine sleep tests. However, UARS does result in disturbed sleep or multiple arousals, which again go often undetected by the affected individual. This then leads to excessive daytime sleepiness. Both sleep apnea and UARS put stress and strain on the body. With this stress and strain on our bodies then go into fight or flight mode. Stress is often linked to clenching and grinding activity. So increased stress in the body, our body being in fight or flight mode, will cause many of us to clench or grind our teeth. Grinding the jaw forward actually opens up the airway. Our bodies will do whatever it takes to breathe. Breathing is the number one, most important, most essential function that our brain will always strive to make sure we do. When we clench or grind our teeth repeatedly, day after day, or in this case, night after night, it will negatively impact the joints and the muscles that surround and support the jaw. When we clench and grind our teeth, we can generate 80 to 100 times more force than normal chewing forces. Imagine that. Imagine taking a hard candy and biting it in half. That's still considered a normal chewing force. Multiply that by 80. Multiply that by 100. These forces can add up over time. They can weaken teeth. They can crack and fracture teeth. Enamel, the outer shell of our teeth, is harder than bone. And if we're able to generate enough force to crack our teeth, imagine how much force that is with clenching and with grinding. This enormous force is also a large strain on the muscles that surround and support the jaw, as well as the jaw joints, the temporomandibular joints. And eventually, all this force and strain on these muscles and joints will lead to TMJ disorders. So jaw joint noises, clicking, popping, crackling, episodes of the jaw locking, headaches, jaw pain, ear pain, neck pain, and more. So patients don't typically come to see me until they're in pain or their jaw is actually locked. So the way that we treat is we get the joints nice and stable and we get our patients out of pain first. So we treat the muscles and we treat the joints. We do this with custom-made mouthpieces, we call them orthotics, myofascial release, and osteopathic manual jaw manipulation to allow the joints to get more stability in them. I have the discussion about sleep apnea and UARS with my patients when the CBCT scan, the 3D x-ray that we take at my office, when that scan shows us a narrow nasopharyngeal airway, then I usually have a conversation with my patient, and I highly recommend a sleep study with a physician, because as a dentist, I cannot diagnose sleep apnea. I can just tell you what my suspicions are, what I see on the CBCT in terms of how large the airway is, and just what I'm seeing in the mouth. If there's obvious signs of clenching and grinding activity, there's usually something driving that. If the patient is diagnosed with sleep apnea, once their joints are stable and their pain is gone, we talk about if they want to transition into an appliance that can treat their apnea. So it's an appliance that will actually hold the jaw forward and therefore keep the airway open. Some patients will have to wear a CPAP in conjunction with an oral appliance, and it really depends on the severity of the sleep apnea and also what the patient can tolerate. So there you have it, my friends. I hope this video helped clear up the connection between sleep apnea, upper airway resistance syndrome, and its connection to TMJ disorders. That connection is distinct, it's there, and I see it on a daily basis. So if you liked what you heard or you learned something new, click like below, subscribe to my channel, do all the things. As always, feel free to ask questions or make comments in the comment box below. And remember, you can never have TMI about TMJ. Thank you.